The following is a paid commercial program. Views expressed belong to its participants and are not necessarily those of the management and staff of WRAL or Capital Broadcasting Company.
It's time for answers to your medical questions. And get an inside look at the latest in healthcare, medical technology, and treatments. This is Rex on Call.
So whenever I eat a peanut, what ends up happening is I get really short of breath. My eyes swell, my lips and throat feel like they're swelling shut.
I've had allergies ever since I can remember.
Allergies, whether just the seasonal annoyance or life-threatening food allergies. There are a lot of questions, and today we hope to answer some of those. Welcome to Rex on Call live on WRAL. I'm Kim Dean Holderness for Rex Healthcare. If you're watching us live now and you have questions concerning food or seasonal allergies, our operators are standing by to take your calls. Your questions may be answered here live on our program by our experts. The experts answering your questions are Dr. Douglas Holmes with ENT and Audiology Associates and Dr. Edwin Kim with UNC's Allergy and Immunology Clinic. To call us here at Rex on Call, just dial the number on your screen. In Wake County, 919-744-3876, and outside of Wake County, toll-free 877-277-6252. If you're watching us as we're streaming live on WRAL.com, you can just email us your questions to rexoncall@rexhealth.com. You can also find us on Twitter. We're everywhere. Send us a message at Rex Healthcare, #RexOnCall. And while you're calling in with those questions today, we have some information for reducing your exposure to those common allergens. So let's get started. Take a look at this. Try wearing a mask when mowing or doing yard work during that heavy pollen season. Change your air filters and heating and air conditioning systems frequently. Keep those windows closed and during heavy pollen season. Wipe down your indoor and outdoor animals before they come back inside to keep them clear of pollen. Get rid of any mildew sources in your home and try changing out feather pillows and wool blankets to cotton or synthetic materials. Also, you can try enclosing your mattress in box springs and plastic covers. Now, let's take a look at food allergies and the important studies being done at UNC. We visited UNC's Allergy and Immunology Clinic where they're working to cure food allergies.
Dr. Benny Joyner is a pediatric critical care physician, but today, he's the patient.
So whenever I eat a peanut, what ends up happening is I get really short of breath. My eyes swell, my lips and throat feel like they're swelling shut.
So he's one of several hundred adults and children taking part in UNC's food allergy studies.
So I just wanted to make sure that if I had an accidental ingestion, because a lot of the foods that I like have peanuts in it or typically have peanuts in them.
This center here at UNC studies children and adults with peanut, egg, and dairy allergies. The goal is to slowly introduce the allergen in dust or liquid form, gradually increasing the dosage.
Hoping that we can build up their immune system so that they can tolerate the foods if they eat it accidentally. We've had a lot of good early results, but there's still a lot of research that needs to be done, especially based on safety. Although it does seem like the kids and the adults can eat more after say the flour treatment, we just don't know what would happen long term with these people. Are we able to truly cure the allergy?
And no, you're not imagining it. Food allergies are on the rise.
And you have no idea why?
And unfortunately we don't. There's just not a clear reason why.
When we visited the center, these children were getting peanut flour mixed with ice cream and pudding just to make sure they'd eat it all. And then they were monitored for 2 hours in case of a serious reaction. Once researchers were confident in the children's ability to tolerate the dose, their parents will do the same at home until their next appointment. Dr. Joyner takes drops of peanut-infused liquid every day and has for the past 6 years. He expects he may be on this treatment for the rest of his life, but he says it's worth it. After all, he just had some peanuts and didn't have a reaction.
I didn't even realize it till somebody after the fact told me, "Did you realize that that had peanuts in it?" I'm like, "No." Woohoo!
And joining us now is Dr. Edwin Kim, who you just met in that piece, and Dr. Douglas Holmes, who's actually a personal hero in our house because he did my sinus surgery and just put tubes in my son's ears. Yeah, so Dr. Holmes, you're doing a lot of this sublingual drops with seasonal allergies, so similar to what's happening over at UNC with the food. Tell us about that.
The sublingual drops are an attempt to cure the allergies. We try and control them at first with things like antihistamines and nasal steroid sprays. But if you're at the point in your life and in your treatment where you say, I want to try and get off these medications and be done with it, then you talk about immune therapy. And traditionally that's either been shots to desensitize, but more recently in the United States, after decades in Europe, sublingual drops have been introduced where you take a little dropper and right under your tongue you're exposed to low levels of whatever you're allergic to, the so-called antigen. And over a period of 2 to 3 years, your reaction to that antigen significantly decreases.
And are you having success with that in your office?
A lot of success, and a lot of patients, a lot of success desensitizing them to their allergens without the need for shots and without the need for visits to their doctors to get allergy shots.
And here's a question I think we're going to get a lot of, which is how do you tell if it's a cold or how do you tell if it's just seasonal allergies?
Well, a cold is going to be something that can happen any time of year. Generally, most of the time in the winter time is more exposure and such. The allergies every year, going by the history, every spring when the trees start going, every fall when the grasses and weeds get going, they have issues. So
you track it by that.
Yes.
And Dr. Kim, are you hoping to get these patients to be able to eat a whole peanut butter sandwich, or do you just want them to be able to tolerate a peanut if they happen to eat it?
Right, so our overall goal would be to try to cure these patients of their allergies so that they can, just like anybody else, eat whatever food they would want to. But if we find that we're not able to fully cure it, if we can at least protect them from these accidental ingestions, from potentially having these life-threatening reactions, I think that would still be a great victory for us.
And you have a lot of studies going on right now at UNC. Who's the ideal patient to help in that study?
Well, right now at this point, we don't know. Most of the studies have focused on children. What we found is that as the allergies persist into adulthood, they're much less likely to go away on their own. So with that thought in mind, we have focused on children. Some of the studies have focused on the very young children, wondering if catching them when they're first diagnosed would be more effective with these treatments, and others have focused on, say, more the teenage or slightly older children as well.
Okay. And Dr. Holmes, you were telling me once that that yellow stuff, that gross stuff we saw in our cars for a couple of weeks, that's actually not the problem? That's not what's causing my allergies?
the yellow stuff is from the pine, and the pine doesn't, thank goodness, doesn't seem to be allergenic, or we just all go crazy.
Yeah.
But it's the other trees that are blooming at the same time in conjunction with the pine.
Okay, and
the
so
oak trees especially.
So somebody who's not ready for the drops under the tongue, what should they be using to kind of handle and manage these symptoms this time of year?
First line therapy is generally an antihistamine, such as Benadryl was an original one, but that makes a lot of people sleepy.
Yes.
So we moved into more non-sedating ones such as Zyrtec, Claritin, Allegra. Many times a nasal steroid spray will be added, like a Nasonex or a Flonase. And more recently, in the last couple of years, have come along Astepro and Patinase, which are actually antihistamine sprays. So you get the effect of the antihistamine spray directly on the tissues in the nose that we're addressing, but you don't seem to get the systemic side effects, the drowsiness and such from the antihistamine.
Okay, and of this, what do they need a prescription for, and what can...
Any of the antihistamines you can generally pretty much get over the counter. The nasal steroid sprays, you need a prescription. There are some generics, such as Flonase is now generic. These you need prescriptions, the antihistamine sprays. And one thing that Dr. Kim and I both wanted to caution people against was the use of Afrin or oxymetazoline, the spray that you spray in that gives you that immediate
it's good
stuff when you really need it. The problem is that if you use it on a long-term basis, and long-term is, it suggests only 3 days, then to stop for a while, your nose can get basically hooked on it, and you get a rebound effect. So you stop the spray, and all of a sudden things come back like gangbusters. And it can be very difficult to get people off those sprays.
So is it best just to avoid them altogether?
It's short term. Short term is fine. A day or two at a time, maybe even 3 days, but then give it a rest, and you can go back to it.
And how do you both test for these allergies? Seasonal allergies versus food allergies.
Right, so especially for food allergies, the focus is going to be on the patient's history. So finding out, what exactly was the reaction did they have? Did they have just hives or maybe difficulty breathing, asthma type symptoms? maybe some vomiting, and then trying to tie that in to whatever they had recently eaten. So was it a particular food that's more common to be allergic to, say peanuts or tree nuts or maybe shellfish? How long after the meal did the reaction happen? Typical food allergy reactions we would expect to happen within a few minutes to maybe an hour or two at most. There are some newer food allergies to meats that seem to take several hours, but in general you would expect the reaction to be fairly quickly after a meal, and I think the focus would be on that history.
You said meats? People are allergic to meats? I've never heard that before.
Right, so it's a fairly new thing that they've been studying intensely at the University of Virginia, and the idea there is that there's some folks who, for whatever reason, when they eat some of these red meats like beef, pork, or lamb, rather than a few minutes after the meal, like most other food allergies, 6, 7, or 8 hours later, they can have a lot of the same types of symptoms. So a classic story would be somebody who went out and had a big steak dinner around 6 or 7 o'clock and then wakes up in the middle of the night at 12 or 1 o'clock in the morning covered in a full body rash.
Okay, that's fascinating. I know people are going to be asking about that. Right. And we're going to be right back after the break to answer your questions. Call us here, that number on your screen in Wake County, 919-744-3876. Outside of Wake County, 877-277-6252. Give us a call. Welcome back. This is Rex on Call live on WRAL. We're answering questions, and we have a stack of them right here between food allergies and seasonal allergies. Okay, this Laura from Raleigh says she has bad headaches, sneezing, sometimes has bloody mucus when she's blowing her nose. Is that a sinus infection?
The sneezing is most likely a component of allergies, but certainly if you have facial pain and headache and a nasty discharge from your nose, it may be a complication from your allergy and have a sinus infection with, so you could have both.
You can, oh. Fun. Tammy from Rocky Mount just left the ER this morning. Allergy-related, a reaction to wheat and white bread and almonds, itching tongue and throat swelling. She's had reaction in prior years, when she had too much yeast. Would having too much of something then cause a bigger reaction, she wants to know?
Well, I think of the list of foods that she had there, the tree nuts and wheat are among the 8 most common food allergens. So peanuts, tree nuts, shellfish, fish, milk, eggs, soy, and wheat make up about 90% of all of food allergies, so I would suspect those over the yeast.
Okay. This is from Karen. Her husband has severe allergies, not sleeping, trouble breathing, taking all prescriptions. Doctor told him it was just allergies. This caller wants to know if it's more than allergies.
Well, what you do about this is the manifestation of the allergy, and what problems it's causing is nasal obstruction, so he can't sleep at night and leads to more snoring and poor restless sleep. So a lot of things can be done to improve the nasal airway with either appropriate medications or perhaps even surgical intervention if it comes to that.
Okay. Annie from Raleigh, I'm unable to tolerate all antibiotics, have an egg allergy, and cannot tolerate allergy shots. What can she do?
Right, so egg allergy is actually brought up a lot when it comes to certain vaccines, actually, not necessarily allergy shots. And the flu vaccine is probably the most common one thought of when, with egg allergy. But recent studies have shown that if you go get tested at an allergy office, you can likely receive the flu vaccine safely.
Okay, this is Caroline from Raleigh. How can I control hives when I get exercising and overheating? Is that an allergy? Overheating?
So
is that a question for a different show?
So it's not necessarily an allergy, I would say, but some people can have histamine, which is a chemical that causes allergic reactions that gets released when they are exercising. Oftentimes an antihistamine like Dr. Holmes has shown, like Zyrtec, can be helpful for those patients, but probably a good idea to come in and get evaluated.
Okay.
Is there an issue, Dr. Kim, with using Zyrtec? I have concerns about using antihistamines in people exercising heavily. Does it keep them from perspiring as well and potentially overheating?
I've heard that from a few patients, but I don't know that there have been some great studies on that. But
my son had that problem when he was a kid, and he's an adult now, but he was on Zyrtec for his allergies, and he'd go out and play soccer, and his face would be as red as it could be. Took him off the antihistamines, and he was a lot better.
Right.
Really?
So it's a concern if your child has trouble with exercise, especially in very hot weather, and they're on antihistamines, to be watching them very carefully for overheating.
So probably should be checking with a physician
Yes.
to talk about all that.
Absolutely.
Okay. Though these indoor and outdoor allergies are not life-threatening in most cases, they can make life downright miserable. Listen to one patient who's found a way to make it through the thick of allergy season without suffering.
For Bethany Bergen, allergies were just a way of life.
I've had allergies ever since I can remember.
They got worse over the years.
I don't think at any point during the year I can breathe. Redness in the eyes would come and go, but they would be itchy a lot of the time.
So after years of suffering, she got tested for allergies.
Grass, dust, mold, I think, was on there. I mean, they said I was literally off the chart for a couple of the allergens.
So for the past year, she's been coming here to see Dr. Mark Clarkson at Raleigh Ear, Nose, and Throat for these weekly allergy shots.
The idea with any kind of immunotherapy, which can take the form of allergy shots or with sublingual drops for treatment, is to sort of adjust you to your problem, sort of change you over the course of a 2 to 5 year treatment period, so that when you're around the same things that bothered you before, you won't react in the same way. You're sort of resetting your system.
He says this immunotherapy through allergy shots or under-the-tongue liquid drops have proven very effective, and there are ways to further improve your seasonal allergies. Try one of those sterilized saline nasal rinses.
With the allergies, I think they can be a big help. All you have to do is, again, look at your car and you see the yellow pollen everywhere, and the same pollen you don't see as well is all over everything as well. You're breathing it in, and so there is some level of benefit from just physically cleansing.
Consider an air purifier for small spaces that cause reactions.
The smaller room air purifiers, I think, can be very valuable in somebody maybe in a work setting. So somebody does great, but whatever is in the HVAC or in their space where they're working gives them difficulty, then potentially a benefit there.
After a year of shots, Bethany says she's breathing clear for the first time during heavy pollen season.
Now that I've been taking these allergy shots for over a year and know what normal people's lives are like without these allergies and with being able to breathe all the time, now I realize how much better it can be.
Coming up, we'll answer more of your questions. In Wake County, call us at 919-744-3876. Outside of Wake County, call us toll-free, 877-277-6252. We're checking the email, too, so email us at rexoncall@rexhealth.com. Welcome back here to Rex on Call Live on WRAL. We have a stack of questions, so let's get to them. This is Kim from Fayetteville. Runny nose year-round, no headaches. Could this be allergies?
We think of allergies when we have seasonal allergies and the pollen's flying, but there are also allergies to indoor things like molds especially. That will give you non-seasonal, year-round symptoms just like what she's describing.
Okay. Rebecca from Chatham County, I have allergy to tomatoes, pollen, and dust. Is there something I can use other than taking oral antihistamines?
Right, well, so I can address the tomato. So tomato happens to be a food that has a lot of this histamine chemical in it. So for some people, they'll be sensitive enough to have symptoms without necessarily being allergic. But for the pollen and dust that she mentioned, you could do a lot of the same treatments that we'd spoken about previously.
Okay. Mary from Raleigh, drainage goes to the back of the throat, causing a sore throat. What can she do? She also has a very hoarse voice.
Yeah, she's got some manifestation not only of allergies but also of sinusitis. So she needs to get checked to make sure she doesn't have an active sinus infection.
I know those well. Okay, Bryant from Raleigh, EpiPen he uses an EpiPen when he has an insect allergy and hives. Do Benadryl tablets work well enough against insect bites to save your life like an EpiPen?
Right, so I would think about those similar to food allergy, actually. So Benadryl can work very effectively, but can take up to 30 to 45 minutes to work. If you're having difficulty breathing or some life-threatening reaction, that's not fast enough. So in that scenario, I'd definitely use an EpiPen.
Okay, and this calls from Hope Mills. Have you heard about cleaning beds and carpets with a carcin? Or a kerosene? What? Is that effective for indoor allergens? Sorry, you're going to have to translate for me.
Well, the whole issue we're addressing in this question would be avoidance. So your first line against any allergy is to avoid it. So if you're allergic to cats, of course, stay away from cats. If you're allergic to dust mites, then things like mattress wraps, eliminating stuffed animals, washing sheets in hot water, putting your pillow and such in the dryer, things you don't wash on the hot cycle, to try and avoid them. So the first line is to avoid them. Cleaning carpets and going all out doing that, unless you're crawling on the carpets a whole lot, may not make a big difference.
Okay, so may not be worth the effort. I think this is our last question before the break. Has taken allergy shots and now sublingual drops. Which one is better? Is there a way?
It depends on your philosophy of things. If you like getting things at home and don't have to go to the doctor's office, or whether you like being under the more immediate supervision of your physician, then of course you do the shots.
Okay, so it's up to the patient, really?
It's a philosophical thing. It's up to the patient and the doctor.
Okay. One last question here in this segment. Kelly from Whitaker's, sneezing spells, eye drainage at night. What could be the source of these symptoms? Anything? Allergies?
It could be. It could be dust mites. That'd be top of the list, because you're exposed to them all night long, especially if your symptoms are worse in the morning.
Okay, we have a lot more questions to go through. We're going to have a final round right after this break. This is Rex on Call. Welcome back to the show. This is Rex on Call. We're taking a final round of questions right now for Dr. Holmes and Dr. Kim. Okay, this one's from Melinda in the South Hills. 6-year-old daughter has allergies, Claritin, Zyrtec, and she uses a nose spray. Her eyes swell. She's sneezing, coughing, some bloody noses. What can she do? What can be done?
Well, so I think the first most important thing would be to come in and get tested and make sure that these are allergies. If they are, then allergy shots or these drops may be potential treatments that could try to get rid of that.
Okay, and this is from Newton Grove. A 4-year-old grandson allergic to egg, milk, and peanuts. Can he eat the pasta if it's been processed in a facility that handles the above?
Yeah, that's been a really confusing new phenomenon for patients with food allergies. They used to, reading labels used to be their lifeline, but now it's gotten very, very confusing. What we usually tell patients is to be conservative and just avoid those foods if there's any concern.
Okay, this is Ramona from Rocky Mount. Is it possible to take too much Zyrtec? She has a breakout around her lips.
Certainly you want to follow the guidelines of any medication that you're using, and too much antihistamine can't be a good thing.
Okay.
Yes.
So if she's having that sort of reaction, maybe go see her doctor.
Yes.
Okay, this is from Teresa. She moved from New York to North Carolina, and she woke up with her eyes unable to open. They're, swollen shut. Is this normal when moving to a new area?
I would say not. I think she needs to be evaluated and see whether allergies are going on.
Okay, and this question's from Durham. What can I take to reduce swelling of the lips and face from allergies? Is that swelling of lips and face, is that common of seasonal or food allergies?
The swelling, it's something that they should definitely come in and get evaluated for. For some people, it could be that their immune system is overreactive and causing swelling from a different reason, or it could be a food type allergy as well.
One of the issues that we really have problems with in adults who are on ACE inhibitors, the medications that are used for high blood pressure, they can have a life-threatening problem called angioedema, which is one of the things Dr. Kim was referring to. So if they have any kind of tongue swelling, lip swelling, when they're on an ACE inhibitor, lisinopril is one of the big ones, they need to see their doctor immediately. In fact, an emergency department immediately.
Okay, good advice. Okay, and this calls from Raleigh, a food allergy to avocado, tomato, oranges, vomiting after eating or even smelling some of these foods. What can be causing the symptoms? Well, obviously the allergy, but what can she do?
Again, I think it'll come down to being seen by her local allergist so that we can test to confirm that these foods are causing the symptoms that they're having. We can do a procedure called a food challenge if necessary, where we actually give them the food that they're allergic to in the clinic to, again, verify that they're allergic.
Okay. We have a lot of questions we didn't get to. We're going to try our best to follow up with all these calls here. Dr. Holmes, Dr. Kim, thank you so much for joining us and answering these questions. And our phone bank has worked so hard, and they're still taking questions over there. As always, consult with your physician about any health concerns. Thank you very much, guys, for coming in. Join us next month for Rex on Call. Our topic is bariatric surgery. That's always a hot topic. Do you qualify? Is it a cure for diabetes? We'll have an expert here to answer your questions. You can email your questions about bariatric surgery in advance to rexoncall@rexhealth.com, and then be sure to join us Monday, May 21st at 1 p.m. right here live on WRAL for Rex on Call. We'll see you then.